Hello, back 1319 students. Today we're going to be starting Unit 3, which has to do with the addiction counseling component. Now remember, this is a introductory course, which is the first course in the series of 3 here at Community College. And so we will just be doing a brief introduction so that you can be aware of where to get the material, what to be looking at, because in the next 2 courses that you will be taking, which are more advanced, they will be talking more specifically, as well as your internship, in addressing the addiction counseling competencies. But I had asked you in the syllabus to download the addiction counseling competencies, the skills, knowledge, and attitudes of professional practice. Now, this is the technical assistance publication number 21 put out by SAMHSA. And this publication was put together to address the competencies, knowledge, and skills and attitudes of social practice dimensions that address clinical evaluation and treatment planning using best practices for substance abuse counselors. So it's important to have a national credential, where you're going to be credentialed as a addiction counselor. And so national credentials identify practitioners who are specialists in addiction assessment and treatment and demonstrate to clients, employers, and third-party payers the skills and the competencies developed through the years of addiction counseling training and work experience. So, saying that, now we'll look at the objectives for this section. And objective 1 has to do with we're going to be looking at defining the behavioral expectations for addiction counselors. And we're going to be looking at learning the competencies composed of knowledge, skills, and attitudes expected in the substance abuse counseling practice. So, we're going to be reviewing some definitions here to be able to talk about so that we can all be on the same page when we're talking about these terms involved in the competencies. So the word competency refers to competence or an ability that you have. And, if you're competent in something, you're qualified or you're capable in that area. And the word model, well, this is used to serve as a pattern, a type, or a design, or a framework for some concepts. And when we say professional, we're saying that this person has required specialized knowledge with academic preparation. So professionalism is a characteristic. And best practices refers to approaches to counseling practice that is evidence-based to support effectiveness. In other words, that you can replicate this, that you can state how it is that something comes about, rather than just flying off the seat of your pants and saying, wow, this really worked and it was successful. And a counselor is a person who works with individuals or groups to promote the optimum mental and emotional health. So now that we're all on the same page of the definition of the terms that we're going to be using in this section, let's turn to the competencies. The competencies were written to reflect current best practices. Therefore, 3 characteristics of competency were emphasized: knowledge, skills, and attitudes. Knowledge refers to something learned and keep it in your mind. Skills refers to the ability to use the knowledge effectively. And attitudes is a mental position or feeling in regards to a state. It was the idea that a model could address general knowledge, skills, and attitudes necessary for all practitioners dealing with substance use disorders and explain more specific needs of professional substance abuse treatment counselors. So when we look at the components of the addiction counseling competencies model, first, the competencies address the importance of standards and behaviors for professional practice in the substance abuse field. So they want you to look at and see that there are certain rules and regulations on how you should behave when you're practicing in this field. And then second, the competencies are composed of the knowledge, skills, and attitudes for counselors working in substance abuse programs. So you can have all kinds of counselors, but in this particular case, we're going to be looking at the specific knowledge and skills and attitudes that are needed by these specialized counselors. And then the competencies recognize that addiction professionals work in a variety of disciplines and share an understanding of the addiction process. So you may have a multidisciplinary team, which means you have various players in the team, like a doctor, a physical therapist, an OT, a family practitioner, a psychiatrist, a counselor, or it could be interdisciplinary in that there's going to be that the addiction counselor is going to be working on some aspects of treatment goals, and then there's going to be a mental health counselor who's going to be working on the co-occurring condition, and then there's going to be a physician working on the on a medical co-occurring condition. So you can see that there's various components to this model. So in looking at your booklet, tab 21, we see that there are 4 transdisciplinary foundations. These are the four areas of sets of knowledge and competencies. So for the first section of the model, it contains the transdisciplinary foundations. Transdisciplinary, we said, belong to various work fields, like study fields like psychology, social work, medicine, LPCs, marriage and family counselors, a wide variety of professions. And foundations are something like building blocks. Okay, so these are the building blocks of understanding addiction, treatment knowledge, application to practice, and professional readiness. Those are the 4 areas. So the goal of these competencies is to help ensure that every addiction counselor possesses to an appropriate degree each competency listed regardless of setting or treatment model. The competency model is conceptualized as like a hub, a hub like your tire, your bicycle tire has a little hub and then it has all these spokes coming out of it. Well, this model is a hub with 8 spokes on it. And the hub itself contains the 4 transdisciplinary foundations. So the 8 spokes are the practice dimensions, each containing the competencies the addiction counselor should attain to master this dimension. Okay? So in other words, it says it has 8 spokes, and those spokes are divided into 4 foundation areas, and that each professional should master all the items that are in there in each foundation area, which is considered a practice dimension. So like the first practice dimension would be understanding addiction competencies. And in your booklet, this is going to be number 1 through number 4. And this is going to include talking about the clinical evaluation process and the actual counseling process. And they're saying that you need to look at all the aspects of this dimension. And in the booklet, it'll say that in each dimension, it's going to be broken down to knowledge, skills, and attitudes that you need to have in that foundation area, like number 1 foundation area. The second foundation area is treatment knowledge competencies. That's going to be addressed in your booklet as number 5 through 8. And so these practice dimensions are going to be dealing with all aspects of treatment planning and referral. And they're going to be talking about the knowledge used that you need to have, the skills and the attitudes for mastering this dimension. And the third foundation is going to be application to practice competencies. And this is in your booklet, it's going to be number 9 through number 17. And so the practice dimensions that they're going to be focusing on here is going to be the client, the family, and community, and providing education to all those sections. And then documentation is going to talk about the skills, the knowledge, and the attitudes that you need for mastering that dimension. And then dimension number 4 has to do with professional readiness competencies. That's going to be in your booklet, number 18 through 23. And that practice dimension is going to be addressing professionalism, ethics, responsibilities of the counselor, service coordination activities, and it's going to be talking about all the knowledge, skills, and attitudes that need to be learned in this section to be able to master that dimension. So you have to keep in mind that there are 4 sets of competencies that are transdisciplinary. So this refers to the knowledge, skills, and attitudes needed by all workers in the field of substance abuse disorders. And also you need to keep in mind that all disciplines share an understanding of the addictive process. The term transdisciplinary describes all disciplines, just like I told you, medicine, social work, pastoral guidance, corrections, social work, licensed professional counselors, marriage and family counselors, psychologists, everyone that deals with individuals with substance abuse disorders. Now, looking at the first foundation that we mentioned, okay, before we even go into this, you need to keep in mind that treatment is a process of intentional change. Intentional means you mean it or that you decided to do something. Change. So treatment is a process of intentional change. Thus, you have to keep in mind that the client has to want to do this. This is a lot of knowledge, skills, and attitudes, and techniques, and strategies, and roles, and philosophies, and program goals. But remember that the client has to want to do this. So the first foundation has to do with understanding addiction. So the clinical evaluation section, this is the section, right? It involves screening and assessment and using appropriate screening and assessment instruments. They have to be current, they have to be scientific, and they have to be relevant. And so it is crucial to demonstrate effective verbal and nonverbal communication skills to establish a rapport with your client. Because your client finally makes a decision that they want to do something about their situation and they want to change, but your communication skills are going to be very paramount here and whether the person understands what's going to be happening or not happening. And so you need to understand, the counselor needs to understand a variety of models and theories of addiction and other problems related to substance abuse so they can have a good catalog in their mind about what is and what isn't and what's available and where different orientations are coming from. So also we need to recognize the social, political, economic, and cultural context within which addiction and substance abuse exists. And you know that is a very complex process and ever changing with society. Some areas, are like stay forever. Some processes stay forever, and some are always changing. So we also need to be able to describe the behavioral, psychological, physical health, and social effects of psychoactive substances on the person using significant others. So here's where your drug worksheets that you did such a beautiful job on are going to be very helpful, because you're going to be educating your client and their family members and possibly community members as to all these things that are happening by all the effects of the psychoactive substances. So you need to respect the client's autonomy in order to get their cooperation, and you must have their cooperation, or you know how that goes. It doesn't work. And explain the structure. It's your responsibility to explain the structure, expectations, and limitations of the counseling process. Don't make any promises you can't keep, and make sure they understand what they're getting into. So recognize the potential for substance use disorders to mimic a variety of medical and mental health conditions and coexisting conditions with addiction and substance abuse. And we've talked about this in the past. This means that you have to recognize that there are other co-occurring disorders, and it's very important during the evaluation and counseling process to sort this out. So screening and assessment you have to screen and assess for physical, medical, and co-occurring conditions that might require additional assessment, and determine the appropriate course of action. In other words, what is their medical condition? What else are you seeing here? And is this the right place? Addiction frequently co-occurs with other psychiatric disorders, infectious diseases, and pain conditions. So the counseling section, which involves summary, diagnosis, recommendation, centers on focusing on coming up what are the client's strengths, what is the current situation, and whether counseling should be individual, group, or family, or a combination thereof. So we go on to the next foundation, which is treatment knowledge. Here, we need to describe the philosophy. We need to be familiar with and be able to describe the philosophies, practices, policies, and outcomes of most general accepted and scientifically supported models of treatment, recovery, relapse prevention, continuing care for addiction problems. We need to be able to reasonably discuss the diagnostic outcome, what the assessment showed, and the recommendations that you're making, and clarifying how you came to that conclusion. And then you need to be able to discuss the strengths of the client, the needs of the client, and the preferences of the client. You need to recognize the importance of family, social network, and community systems in treatment and recovery process. And you need to include the concerned others in intake and the treatment process, because as you well know, most people will be going back to the same environment. Very few will be making a total radical turn in environment. And so if you're not helping what's happening if you're not healing what's happening in the environment, then the person who's healing in the process is going to have a very challenging and difficult time. Relapse is on the horizon. So you need to understand the importance of research and outcome data and their applications in clinical practice. So that means that you need to formulate the problem, prioritize mutually agreed upon goals. You can't work on anything unless the person agrees to it. And it's best that the client help design the goal, because if the client doesn't design the goal, then you're not going to get the ultimate cooperation. You need to have measurable objectives. This is how the person and you are going to know what if they're making progress or not, and at what point should they be at certain point. And then you discuss treatment methods. Excuse me. You need to understand the value of an interdisciplinary approach to the addiction treatment. That means you need to understand how a team works and be a team player, and include your treatment team in all information aspects. There needs to be good communication among the treatment team, and you need to be aware of what the supervision policy is and when to access a supervisor. So we go on to the next slide, which has to do with the foundation of application to practice. And here we look at how to understand the established diagnostic criteria for SUDs and describe treatment modalities and placement criteria within the continuum of care. What that means is we're going to be providing education regarding the emotional and cognitive and behavioral aspects of substance use. We're going to provide education regarding the physical aspects of substance abuse. We're going to be providing education on any health and medical issues. And we're going to be talking about high risk behaviors that are associated with substance abuse. We're also going to be describing a variety of helping strategies for reducing the negative effects of substance abuse, use, and dependence. Here, that means we're going to provide education on life skills. Most people are where they're at because they have serious deficits in coping skills and life skills. So here would be examples of you teaching stress management, relaxation strategies, effective communication strategies, refusal skills, assertiveness. You see that here's where you're going to be doing the skill building. And you're also going to be tailoring helping strategies and treatment modalities to the client's stage of dependence, change, and recovery, which means you're going to utilize the counseling strategies and modalities to match the interventions with a client's level of readiness. You know, if you have a very sophisticated plan and the client isn't there, you have to take the client where they're at. And then the other thing is to provide treatment services appropriate to the personal and cultural identity and language of the client. You've got to match the client's needs with the community resources to remove any barriers or formulate positive client outcomes. An example, you have to look at their cultural ideology and be sensitive to that. You need to look at their ethnicity and how it's affecting it. Treatment, if it will, sexual orientation, age, gender, health status, and mental, developmental level. And so you need to adapt to the range of treatment settings and modalities. So you've got to adapt the practice to that range. You use ongoing assessment and collaboration with the client to review and modify the treatment plan and address treatment needs. You don't make a treatment plan and then, say, okay, we're going to do this the next 10 weeks or whatever. It may be ongoing. You need to check it regularly. Make appropriate referrals when identifying clients' needs, which cannot be met in your current treatment setting. So if that happens, you have to assist families and concerned others in understanding the substance use disorders and utilizing strategies that sustain recovery and maintain healthy relationships. So if you find out that something's going on that's beyond the scope of what your treatment facility does, it's your responsibility to make that referral and actualize the referral. It's also important for you to make sure that that the family understands what's going on, and that they're involved in this, and that they're utilizing strategies also for themselves recovering and maintaining a healthy relationship with the client as the client evolves. And then as an extension of this foundation application is foundation dimension is application to practice part 2, which is to be familiar with medical and pharmacological resources in the treatment of substance abuse disorders, understand the variety of insurance and health maintenance options available, and the importance of helping clients access those benefits, because most programs need financial compensation, and a large portion of the population that we're talking about may not have insurance. So recognize that crisis may indicate an underlying substance use disorder and may be a window of opportunity for change. So you need to assess the client's current situation, including signs and symptoms of intoxication and withdrawal, by evaluating observed behavior and other available information to determine the client's immediate needs. Like, what if your client shows up to group drunk, or what if high, or what if someone has a seizure? What it's saying here is that you need to be aware of that and understand what's going on in the person's underlying substance use disorder, and what you can use this to work for the person, or the person can use it to work against themselves. Understand the need for and the use of methods for measuring treatment outcome. So you need to evaluate the effectiveness of the counseling strategies based on the client's progress in order to determine the need to either continue or modify the treatment strategies and the treatment objectives. So here it's really important to develop an effective continuum of recovery plan, which the client, in order to strengthen ongoing recovery outside of the primary treatment. So here we need, as part of the treatment process, we need to come up with a recovery plan with the client. And it needs to be one that he can actually actualize outside of the treatment thing, because you're not going to be there for them forever. And so remember, an important part of the application to process to practice is documentation. So if you didn't write it down, it doesn't exist. I mean, it's your responsibility to know what the documentation responsibilities are and to fulfill them. So it's important for you to obtain written consent and have that documented. It's important for you to have releases of information from the client or legal guardian if you're going to exchange any information, and you need to have that documentation available. And you need to have documentation regarding any counseling activity you produce, and all relevant aspects, of treatment activity need to be documented, and any aspects of case management activity needs to be documented, and any continuity of care activities need to be documented, and you need to document the process, the progress, and the outcome of the objectives and measures you're using. And you need to, when you're documenting, you need to you need to prepare accurate, concise screening tools. You need to write effectively as to what the intake process was and the outcomes of that, and any case management. So it is very important, because documentation is just as important as any other aspect of your treatment components. So the fourth foundation is professional readiness. Here they say in the field that 80% of what determines a strong therapeutic alliance is due to the counselor's portrayal of warmth and empathy. 20% is on knowledge and skills. So when they say warmth and empathy, that doesn't mean to become their friend. That means that you need to be accepting, respectful, non-judgmental, and a good listener. So we need to understand in this dimension, when we need to understand diverse cultures and incorporate the relevant needs of culturally diverse groups and disabled people into the clinical practice, which means we need to address whether we're disabled, we meet the disability compliance guidelines, whether you need translators uh, for the particular language. And it doesn't mean that you just grab anybody who's Hispanic for Spanish speaking and come in and talk trochi mochi. You need to actually have people who understand what professional terms are and therapeutic terms, because therapeutic terms in another language are difficult. Same thing with if you have someone with sign language, you must have a sign language interpreter, etc. So understand the importance of self-awareness in one's personal, professional, and cultural life. Engage with clients and make them feel like a person. Be aware of your strengths and areas of improvement. And make sure that you're in presence of mind in every session. I know it happens, but you're looking at the clock to see if it's time to pick up the kids and you need to wrap up, or somehow you're bored and you're doing your grocery list in your mind. Your client deserves privacy, not meeting under a tree or something, or out on the porch, and they deserve your undivided attention, which means that when you're in a session, you're being present in every session, mentally, physically, psychologically, etc. And so you need to be empathetic, supportive, but use a directive style. Stay away from confrontation. I mean, I've never found that very productive. And when somebody's confronted with me, you know what happens, the same thing that happens with you. So, be directive, not confrontive. So understand the importance of ongoing supervision and continuing in education and the delivery of client services is the ongoing process. Continuing education is the ongoing process of developing and maintaining and documenting your professional skills and keeping up your professional skills. Using supervision is really important. Maybe the ideal case would be for you to be able to do your job. That's why they hired you, because you had certain skills. But for you to know when it's important and if something doesn't sound right, and you can feel it in your gut that you need to go talk to someone or you need to check something out, this is a good time to utilize your supervisor. And you also need to follow the guidelines of the agency's guidelines as to when supervision is required or suggested or recommended, because it may be something different than what you had in mind. Understand the obligation of addiction professionals to participate in prevention and treatment activities, and understand and apply setting specific policies and procedures for handling crisis and danger situations. And here, make sure that you have safety plans, that you use common sense, because a lot of our clients sometimes may not be lucid. They may be aggressive. And so for their safety and your safety, you need to be able to look at handling crisis or handling dangerous situations, whether not to close the door, whether to sit close to the door, whether to have someone in the hall. it's look at the policies that you have in your own place about home visits, etc., and what procedures you need to follow for the client safety and for your safety. And that concludes our section on counseling addictions. The next section will be on ethics, code of ethics, which dovetails into this process. And so before that, at the end, there is a video that I've included on how to find a good addiction counselor. And she talks about how to find a good addiction counselor, but she also mentions a lot of things that items, issues, concerns that you might be looking at yourself as a counselor. All right, thank you.